As you all know, allergy is very common for many people in Kuwait and outside of Kuwait. In essence, allergy means a reaction for the body to something that's in the environment that should not be. We are predisposed to that by our genes, but at the same time, it's affected by the environment. For example, people may complain of having nose and sinus allergies, which means having itchy of the nose, sneezing, nasal congestion, and when it's chronic, when it's long-lasting, it can have effects on sleep. It could be snoring, open mouth breathing, bad mouth smell as well. Other allergies can affect the lungs, where you have, example, cough, wheeze, or phlegm, or it can have allergies affecting the skin, resulting in eczema or urticaria. Sometimes you can have allergies to drugs, and other times you can have allergies to foods, while other times the environment, for example, our pets, cats, dogs, or birds, or cattle animals, or pollen and mold in the environment can give you the symptoms and signs of allergy. Allergy is a chronic problem. It starts in childhood and usually changes as we get older, sometimes getting better, other times getting worse. For the allergist, the main important thing is to identify the causes of your allergies. We do that by doing special testing called IgE testing. This test could be done through the skin or through the blood. And by doing the test, we can tell exactly if you have an allergy, for example, to a cat or pollen that's affecting you. Some people allergies are all year round, so they don't stop at all. Could be all the months of the year. And that affects their lifestyle, their ability to work, to sleep, and for children, the ability to study and go to school and learn. For others, it happens in seasons. And the seasons in Kuwait are different than seasons outside of Kuwait. As well, it depends on the kind of the allergen, the thing that's causing your allergy, if it's there in your environment all the time, or if it's there only in a particular season. I'd like to share with you the Kuwait pollen calendar, which shows the seasons in allergy and the cause of allergy in Kuwait for you to understand what could cause your allergy. The Kuwait pollen calendar is this calendar, and you could maybe focus on that and have a better look. So this is a calendar that's done by the Kuwait Institute of Allergology, and we look for different things in the environment. You can look at different sides with the different trees and pollen types of different sides, and then you can have the month, January, February, March, and December. Green color means you have a high concentration of that particular allergen in the environment. If you look at the Kuwait season, you'll notice a very important thing. We have two peaks of allergy between February and May, and another peak of allergy that's even larger that starts between August and December. And those two peaks coincide with the major allergy symptoms that people have in the Kuwait environment. They would have, during those times, cough, sneezing, asthma problems, requiring medication to help them breathe as well. So this is the environment allergies. Now, in Kuwait, being a desert environment, the most common allergen in Kuwait is something we call salsula, or it's called in Kuwait arfaj. So this particular pollen is in Kuwait all year round, and for some people that causes their allergy symptoms. That affect their eyes, their nose, their breathing as well. And that's the major cause of the peak during September time, where you have the major allergy symptoms. As well, when you look at March and April, the major allergy pollen in that time is Bermuda grass, the grass that you see in the gardens, in the parks, and in other play areas like playgrounds. Often people say, "Doctor, I don't go outside too much, or I don't have that kind of desert environment around me." It's not as easy as that, because especially this pollen is in the air all the time, and it's carried by air all the time. So it doesn't have to be in your home. You can have pollen coming from thousands of kilometers around your house in Kuwait and affecting you, even sometimes over different countries, not only from Kuwait. The majority of asthma patients and sinusitis and rhinitis patients in Kuwait are allergic. About 80% of them do have a positive allergy test, and they suffer because of that, requiring medication to help them breathe and sleep normally. The majority of those patients do not take proper medication. they take over-the-counter medication through the pharmacy. About 50% to 60% of people do not treat their allergies properly. And about 50% of people don't recognize that they have the symptoms of allergy. And they confuse allergy, for example, with a cold. A major difference between a viral infection and allergy is this. With viral infections, you get a lot of fevers, you get a lot of muscle aches and pains, and the symptoms normally don't last more than a week to 10 days. But in people who suffer from allergies, they often get the symptoms of nasal congestion and sneezing and so on for longer periods, sometimes for weeks, months, or years. So if you suffer from an allergy that's lasting or symptoms lasting more than a week or two, you have to consider whether this is caused by an allergen. Another common allergy in Kuwait is caused by cats and dust mites and molds. And although many people have allergy to cats, they say, I don't see a cat. In fact, the cat dander allergen is all over the place. Cats walk all over the place and drop their hairs, their skin, and whenever we walk on that, we basically take it inside our homes. The cat allergen is very strong. Even if you clean your house for 6 months continuously and wash it continuously, you're still gonna find some of the cat remaining inside the house. So it doesn't have to be living with you. If you meet a friend who has a cat, or a friend who has said hi to another friend, or hugged another friend, or kissed another friend, and they have a cat as well, they will transfer the cat allergen into their skin, and when they meet you, they will give you that allergen as well. So these allergens, it's important to recognize that they are part of the environment, and they don't cause in all people these problems, but if you do have this problem, then it's good to have treatment for that. It's not good to take a lot of medication just to treat the allergy. It's important to avoid the allergen so that you don't have to take a lot of medication. And that's what the allergists try to do. Find the reason in order to reduce the effect and the need for medication and seeing doctors and going to hospital too many times. Talking about the environment allergies, you have to recognize that it changes with seasons. So for example, when there's rain, some allergens get worse. When there is wind, some allergens get worse. When it's dry, some allergens get worse. And that depends from one person to another. I often say that when you get a dust storm, dust is not the problem, because dust is only a glue that carries with it all these allergens. So basically the dust particle is glued to it, the pollen, the mold, the cat dander, the insect as well, some bacteria, some viruses as well, and a lot of pollution as well. So when we get a desert storm, or when you get an environment that has lots of dust, like we have in Kuwait, usually in around April and May, sometimes in September, October as well, what's giving you trouble is not exactly the dust itself, it's actually the cocktail of items inside the dust that would give you these problems. And sometimes it's not an allergy, and other times it is. By this, I will try to conclude my talk today, and we'll continue to talk about the allergy in the next session. Thank you.